And in today's health segment, we'll delve into brain tumors with neurosurgeon Dr. Inyanje Sylvie. She will guide us through the signs, symptoms, and treatment options. Take a look.
So, brain tumors, there's a myth that if you eat this, you'll get brain tumors. If you hit your head somewhere, you'll get brain tumor. But brain tumors usually are the differentiations of cell that is abnormal. It's mostly caused by genes. It might be hereditary. It might be caused by other diseases, being exposed to X-rays, and there are many causes, but those are the most commonly known. Smoking causes other cancers like lung and other cancers in the other parts that can metastasize into the brain. So that's how smoking can cause brain cancer, but it's not among the primary causes of some cancers in the brain. There are no particular signs that leads to brain tumor. There are signs and symptoms that can tell a doctor that you might be having a brain tumor. Even though everyone, like 99% of people, have headache. Headache is not just a headache. It might be a headache, but it's one of the signs that someone could be having something into the brain, not only the brain tumor, but each thing into the brain or into the cranium. So you can be having a headache, blood vision, issues with the vision. If a headache is associated with vision issues, you might think of a tumor. Someone who might have seizures. Seizures is a sign of something happening into the brain, among them being a brain tumor. You might have a decreased level of consciousness, as you might start getting confused, not remembering things or confusing everything, or even being into a coma, being the last or the hemiplegia, or getting paralyzed, one side or both sides, paresthesias, things according to related. They are all related to where the tumor is located. I talked about the vision, the inability to speak, or even anomia. You can be speaking and you can't find a word. Though it happens to everyone, but it's a sign when it usually happens, or even the people who start with tics. So there are many signs according to where the tumor is located, those being the early detection is very important, as when the tumor is not that big, the resection of it would be easier. To remove a bigger tumor is associated with more complications than removing a smaller one. And as it's becoming bigger, we usually say that if the brain is, time is the brain. As the brain is being compressed for a very long time, it's more difficult to recover from it. Like when you've lost your vision, it starts being blurred vision, you can't see around yourself, and then you get blind totally, you can't see the light. It's more difficult to see again when you've lost your vision totally than when you can't see, you almost lost your vision. So it's better to detect it earlier and to treat it earlier, so that you can't cause irreversible complications. As early detection, if those tumors that can be hereditary are seen, we usually we have to see all the family and to do exams so that we see if they have those genes or those kind of tumors. The preventive measures are not that much, but detecting it earlier is better. Benign tumors and malignant tumors. So malignant tumors, they are the ones that we usually call cancers. Benign tumors are just a swelling into the brain. So when they are operated on successfully and removed totally, they have a probability of healing up to 100% completely.
What about malignant?
But malignant tumors, depending on which malignant, on where it is, it's not. They have the risks of being recurrent. They can recur in, depending on which cancer it is, in a time limit, 1 year, 5 years, 10 years, things like that.
Can benign tumors become malignant?
Yes.
How?
Some of them become malignant on the recurrence of them. When they recur, or on the first resection, for example, it was a benign tumor, and on the recurrence, it changes the morphology, the composition of it, and it becomes a malignant one. There are not many tumors into the CNS that can do that, but it can happen. We don't have recent studies in Rwanda, but estimatively 80% or 90% survive on those tumors and they heal completely. But there are other ones who don't. It can happen. It's a complication as anything. Everything has complications, so it can happen.